Hi guys, and welcome to a 360 experience. What we want here is for you to have the best experience while preparing for refractive surgery. Here I have my very good friend Andres. We have a patient and you're gonna experience the entire journey of the patient. Andres, how are you?
Hi Ivo, how are you? How are you guys? You are right now in the Oftalmo University campus. I'm here in Argentina, excited about this new experience, the 360 surgery experience.
So we're gonna start first talking about the patient. This patient has 42 years old. Here we can see the topography. We can see an objective skiascopy with a minus 5.25 of myopia and minus 5.50 of cylinder. Okay, it's very important for us to understand the age of the patient, what it does. She works in the computer 8 hours per day and has also 42 years old. So tell us, Andres, if you have this patient in front of you, what are your thoughts?
Thank you, Ivo. Here we have many different important points in this patient. First of all, the age. You just said that the age is very important. She's 42 years old, presbyopia, it's coming. So we have to be very careful with this in the future when we chose the treatment and when we chose the options for the patients. She has a myopia, a high myopia, -5. So we also have to see if she's a candidate for a PRK, SMILE, or LASIK. So all the things, all these steps, step by step, we're going to be doing right now with Ivo and all the technology and the Alcon Experience Academy.
Perfect. So the important is the journey, right? The important is the planning and the first diagnosis, and then we're gonna come here to do all the planning in the excimer and femto machine. So let's go to see the first examination. We have right here the oculizer, and you guys are gonna see in the screen what are the values for this patient. What do you think, Andres? We're seeing
Well,
yes.
yes, I'm sorry, Ivo. This is one of the most important examination for us, the refractive surgeons. We have to be very careful here. We have to understand the importance of a good topography. So here we can see the axial map. We can see the elevation front and elevation posterior elevation. Everything looks good. The pachymetry, she has a very good pachymetry. We have a good cornea. Remember, guys, she's -5. So that is very important. We need to have a good stromal, bed stromal after the surgery. So pentacam, like this one, the oculizer, it's very important. We need to see every detail of this patient. Ivo, can you see what is the thinnest point of the cornea? Can you tell me that?
Yes. So if we go to the results, the thinner ocular cornea is 572.
Excellent, excellent. As I just said, we have a very good thick of the cornea. So I think in this patient, if of course she agreed with this, maybe we can think in a PRK or a LASIK.
Perfect. So we first understood the patient, the characteristics, then we saw that she had myopia. Now we're seeing the topography that needs to be in the correct measurement. And now we're gonna see here the Allegro. In the Allegro, we're gonna also have some maps that are gonna help us to understand better, the situation of this eye. Andres.
Thanks, Ivo. One of the other important things that we have, all the technology that we are able to use is the customized surgery. So in this patient, we can see that she has a very low astigmatism, very irregular. The concentration or coma, it's very low. So this patient, maybe she could be a good candidate for a wavefront optimized. There are patients with irregular corneas, no virgin eyes that we can think in a customized surgery. So this is why the Fourier maps are so important when we are planning a refractive surgery. Remember, guys, when we have some doubt, when it's a virgin eye, wavefront optimized, it's an excellent option for our patients.
Great. So then, we are understanding the characteristics of the cornea, and now we need to start thinking about the femto and the flap creation. And right here, you can see me. I am going to have the patient interface. We're going to do the entire procedure in a bit, but before we need the planning. And in the planning, everything is extremely important, especially in this case that we can personalize the planning very much. What do you think about this patient? We already have all the parameters inside, Andres. How we can personalize her treatment?
Excellent, Ivo. Well, finally, we have decided a LASIK surgery, a femto LASIK for our patient. So remember, she has a high myopia, so we're going to try to keep the rebed stromal higher or thicker as we can. So we're going to choose a 90 micras flap. As you can see, Ivo is choosing, he can choose a 90, 130 or 150 micras in the flap. So we want to have a thinner flap, and we can also choose the position of the hinge. It could be superior, nasal, or maybe 120 degrees. It's up to you. This is the magic of the customized surgery, guys. Right? You can personalize the flap of each patient.
Excellent. So after we personalized the flap, then we're going to go and personalize the ablation. What can you tell us about this, Andres? We have already the patient right here, minus 2.25, minus 0.50 and 93 degrees. We can personalize the target. We can personalize the correction, the corneal parameters.
Everything. We have so many options, guys, and this is why the refractive surgery is so amazing. Now we're going to choose, for example, an optical zone that's 6.5 millimeters. Again, we talk about the flap of 90 micras because we want to have a very thin flap. And as you can see, it's a wavefront optimized treatment with myopia ablations. And you can see below the image of the cornea, the ablation profile, we're going to have 85.40 micras of ablation. So we're very good. We're very careful with this because the pachymetry, it's thick. So we're going to be fine with this patient, Ivo.
Okay, so guys, you had a 360 experience. First, understanding the characteristics of the patient. Second, we understood the cornea structure and interpretation. And then we did all the planning together. So let's go in the next videos to do the flap creation and the ablation.